Good day, everyone. I am Leonardo G. Orachner of the BSN1 from the College of Health Sciences of Mindanao State University, and this will be my video report for the microbiology and parasitology. So, this discussion, we will be talking all about leptospirosis. So these are the contents of my presentation. We will start with a brief history of leptospirosis. So in ancient times, Chinese already recognized leptospirosis as an occupational hazard of rice harvesters. In Japan, leptospirosis is also known as Akiyama and or autumn disease. So before this disease has become has become has named is named after is named leptospirosis, it has already become prevalent in Asian countries during early centuries to um, to affect on the farmers or to anyone who works in the fields or in the mountains. So in the western countries in 1812, Larry described leptospirosis as fever John, or this roughly translates into jaundice fever or contagious jaundice. So this was thought to be related to bubonic plague but not as contagious. So during pre-colonial era or during colonialism, some colonialists brought back with them um, diseases to European nations and to Western countries or states. So in 1883, leptospirosis has become recognized as an occupational disease of sewer workers. This is because some wild animals migrate into the city and make nests into sewage system and feed or strive on the industrial and domestic wastes. So in 1886, Adolf Field describes the most severe symptoms of leptospirosis. So the disease would later be known as whale disease. So he described four severe manifestations of the disease: the severe jaundice, fever, hemorrhage, and kidney failure. So in 1907, Stimson discovered the causative agent of the disease using a special staining technique during an autopsy. So the responsible microorganism is then called Spirocheta interrogans. It was named after that because of its resemblance of a question mark. So in 1916, in Japan, Inada et al. Further identifies the causative agent of the infectious jaundice and named it Spirocheta ecterohemorrhagiae. I'm sorry if I pronounce it wrong. Okay, so next, let's proceed. So the leptospirosis is also goes by other names as well. It is also known as cane-field fever, canicola fever, field fever, mud fever, 7-day fever, spirochetosis, and swineherd fever. So if you have noticed, most of the fever relates to fields or farms or in the mountains. This is because the disease originates or came from wild animals. So it is an infectious disease that affects humans and animals, including birds, amphibians, and reptiles. It is an infectious disease that is caused by a pathogenic bacteria called Spirochet and is thought to have potential to become prevalent or predominant with the changes of the climate and the related trends. So the causative agent of leptospirosis species of leptospirosis are the leptospire species of the spirochates, or the family of Leptospiraceae. So these organisms are described as obligate, thin, mobile, finely coiled, gram-negative, slow-moving microbes about 6 to 20 micrometers in length. So the one in the background is an example of a species of Leptospiraceae. So there has been a lot of revisions of naming leptospires to organize them, which leads to difficulty in reviewing related studies of leptospires. So the traditional system of classifying these organisms are based on the antigenic differences of the lipopolysaccharide envelope surrounding the cell wall. The leptospire genus is divided into two species, the pathogenic Leptospira interrogans and the non-pathogenic Leptospira biflexa. So these species are then further divided into serogroups, serovars, and strains. So the Leptospira interrogans has at least 218 serovars, and the Leptospira biflexa has at least 60 cerovars. So what are the modes of transmission? So how are these diseases transmitted? Although the primary suspect of this disease are urine from rats, the infection starts when an open wound encounters a contaminated water, food, or soil, or when a person ingests a contaminated food or water that contains urine from any infected animals. So it is not just from any rodents or rats, but some other animals as well. So other modes of transmission of this disease include animal biting, prolonged immersion of skin in contaminated liquids, exposure to mucous membranes, inhalation of aerosolized bacteria, transmission through the placenta during gestation or pregnancy. So a person can get infected when the skin is immersed in a contaminated liquid for a long period of time because leptospirosis can dwell onto the skin, especially um, on the soft parts of our skin or the most sensitive parts of our skin, such as the perineal area and the conjunctiva under our eyes. So leptospirosis can be aerosolized when the leptospirosis migrates onto the lungs, and so when a person aspires or coughs, the exhaled leptospirosis became airborne. In the case of transmission through the placenta, there are cases when a child is born with a condition of jaundice, and this is because the pregnant mother or the mother has problems in the kidney or the liver. So some of the suspect of the one of the suspect of this is leptospirosis. So when provided with sufficient nutrients, the incubation period is usually around 5 to 15 days, but then later to be observed from 72 hours to a month or more. So this disease has a wide range of clinical manifestations and sometimes shows asymptomatic symptoms. But the most evident pathognomonic sign that indicates a patient is infected with leptospirosis is usually the vasculitis of capillaries. It can be assessed by endothelial edema, necrosis, and lymphocytic infiltration. This is why it is important during assessment to assess for any edema, lumps, swelling, or inflammation and necrosis. The capillary vasculitis can affect any and every organ system, especially that the leptospirosis can dwell or primarily targets the vasculatory and tubules and junctions between and each of every organs. So this results in the loss of red blood cells and fluid through enlarged junctions and fenestrae. Fenestrae is another word for holes. So this results in secondary tissue injury that accounts for many of the clinical findings. So when leptospirosis migrate into various organs of the body, they may cause various complications as well, one of which is fluid leakage and circulatory hypovolemia from hemorrhage. So circulatory hypovolemia is a disruption of fluid homeostasis, which results from escaping of fluids or bloods from the vessels, which is the hemorrhage. So when leptospirosis migrates into the kidneys, they can cause interstitial nephritis or inflammation of tubules and tubular necrosis. So this results in kidney failure. So most probably that the leptospirosis can migrate into the adrenal gland just beside the kidney and cause inflammation. So when the leptospirosis migrates into the liver, they can cause disruption of hepatocellular junctions, either by swelling or inflammation, which results in leaking of bile, which then causes jaundice. So for the cardiac lesions, they are assessed or discovered during autopsy. So these are the rest of the pathognomonic signs and symptoms. So first is high fever or hyperthermia or pyrexia, arthralgia or joint pains, splenomegaly or enlargement of spleen, severe headache, sore throat, chills, muscle aches, vomiting, red eyes, abdominal pain, diarrhea, mental disturbance, and rashes. So fortunately, The leptospirosis can be treated with antibacterial drugs such as penicillin, oral doxycycline, streptomycin, chloramphenicol, and erythromycin. So patients who are respiratory distressed can be treated with mechanical ventilation, and in cases with patients with severe liver and kidney failure, they are treated or they are subjected to peritoneal dialysis. So how can we prevent or control this disease? Encountering this disease may or can be prevented with the practice of proper precautions. And it is important that this should be taught for the good of the community, not just for every individuals. So this include avoid contact to environments contaminated with animal urine, and most especially the rodent-infested areas. Avoid exposure of environments with any wounds or abrasions on the skin. Avoid ingesting or swallowing substances from lakes, rivers, or swamps when swimming. Perform hand hygiene and shower immediately after having contact, and treat and cover any wounds or open wounds or cuts or abrasions, and take antibacterial medications. Wear proper protective clothes and boots. Drain potentially contaminated water and discard work and domestic waste properly to reduce rodent population. Then lastly, vaccinate pets who are at high risk of contracting the disease. So the following are the nursing priorities in the care of patients who are infected. So first is we're going to isolate infected patients. Disinfect all soiled clothes or articles and report or all cases of leptospirosis. Then treat with antibiotics, which should be given in the earlier course of the disease, and provide IV or intravenous antibiotics to patients with severe symptoms. And investigate all contacts and source of infection, and wear PPE or personal protective equipment when meeting infected patients, and perform hand hygiene. Okay, so that ends my presentation. Thank you for listening and watching. I hope you learned from this discussion, and have a great day.